Did you know that after gallbladder removal, your body will try to activate a little-known backup system to take over the functions of the gallbladder? It's true. In the next few minutes, I'm going to explain the gallbladder backup system and how to support it. This strategy can be a game changer for those who have had their gallbladder removed. The gallbladder is a small sac under the liver that collects, stores, and concentrates bile. Bile, produced by the liver, aids in the digestion and absorption of fats in the small intestine. When fatty foods enter the small intestine, the gallbladder contracts, releasing concentrated bile into the digestive tract through the bile ducts. This concentrated bile helps emulsify and break down fats, facilitating the absorption of fats and fat-soluble vitamins into the bloodstream to support brain function, cardiovascular health, normal vision, and energy production. When the gallbladder malfunctions and causes symptoms, removal is often recommended. In fact, gallbladder removal is one of the most common procedures in the U.S., with more than 1.2 million removed annually. Recent studies show that people without a gallbladder are at higher risk for high blood pressure, high blood sugar, high cholesterol, and increased belly fat. This is likely due to two reasons. First, the body's ability to absorb healthy fats and fat-soluble vitamins like A, D, E, and K is reduced, causing potential nutritional deficiencies. And second is the unimpeded flow of bile from the liver to the intestines. Because bile is not being collected in the gallbladder, there is no feedback loop to the liver, so the liver increases bile production and bile flows into the intestines even though there may be no food there. This can stress the liver and cause symptoms like loose bowels, gas, and bloating. In the next few minutes, I will show you how a common herb can mitigate the effects of the unimpeded flow of bile. I will also show you the supplements that I recommend to help replace the functions of bile. And I'll show you how to activate the body's gallbladder backup system using research-tested acupressure points. My name is Dr. Barrett. I'm a chiropractor, nutritionist, and herbalist. I'm certified in acupoint physical medicine and pet acupressure therapy. I've helped thousands of people live healthier and happier lives, and I'd like to help you too. If you like this video, please give me a thumbs up, subscribe, and hit the bell icon to be notified when more videos like this come out. The first herb that I would suggest for anyone who has had their gallbladder removed is slippery elm. Slippery elm binds bile in the intestines, slowing its passage and reducing side effects, and allowing time for the bile to be reabsorbed into the system, thus restoring a feedback loop to the liver. The next thing I recommend is taking supplements that support the digestion of fats and promote absorption of healthy fats and fat-soluble vitamins. There are numerous options here. Choline is a great option because it helps to metabolize fats and fat-soluble vitamins. Another option is lipase, an enzyme that helps break down fats. Lipase can be found in many digestive enzyme products. The third thing that I recommend is activating the body's backup system, which is the pancreas. The pancreas creates and releases enzymes on demand to help digestion of various types of food, including fats. There are 3 acupressure points that are traditionally used to support pancreas health, and I recommend that you activate all 3 because they work together to produce best results. The first point is located a little bit below your knee. To find this point, find your kneecap, which we'll say is right here, and find the lowest point right here. Then find the point that is the width of 4 fingers below your kneecap right over here. Now find the point that's the width of your index finger to the side of that right here. Push in to find a point that is sensitive, sore, tender, or painful. That is the point. Massage this point in a circular motion for 1 to 2 minutes, like this. Or if you have an acupressure tool called a Teishin, you can activate it by pulsing it 25 times like this. And here's another view. Now find and activate this point on your other leg. The next pancreas support point is located a little bit above your belly button. To locate this point, find your belly button right over here, then place your flat of your hand just above it like this. Find the point that's above your hand right over here. Push in firmly to find a point that is sensitive, sore, tender, or painful. That is the point. Massage this point with a firm pressure for 1 to 2 minutes like this. Or if you have a Teishin, you can activate it by pulsing it 25 times like this. And here's another view. The third and perhaps most powerful point to support the pancreas is located a little bit below the wrist. In addition to supporting the pancreas, this point has been traditionally used to clarify the brain, suppress pain, and improve heart function. To locate this point, find the crease of your wrist right over here. Now find the center right here. Now find the point that's the width of 2 thumbs below that. Right here. It's not necessary or advisable to push in deep here because there are important arteries and nerves and veins there. Activate this point by gently massaging it in a circular motion for 1 to 2 minutes like this. Now find and activate this point on your other arm. My usual advice to patients in my practice is to activate these points 3 times a day for 30 days and then use as needed thereafter. The next step to address the underlying factor of many digestive problems is stress. I've put my video here. Check it out.